Setting up a primary infusion using the B-Braun pumps. First, we'll start with hand hygiene. Then we'll verify our physician orders. We'll also make sure that this is the correct patient, comparing the name band to the physician orders or the MAR. We'll compare our IV solution to the physician orders, making sure we pick the right IV solution. We'll also want to make sure that the IV bag is clear, there's no sediment, there's no leakage, and it has not expired. We'll take our IV tubing, and for this one, we will be using the ported tubing. We'll open our IV bag, taking off the blue, and we'll take off the cap off of our spike. We're going to spike our tubing, and we'll close our roller clamp. We'll hang our IV bag on the pole. And we're going to open the door of the pump. Confirm that we want to open the door, and the door will pop open. We're going to thread the cartridge into the IV pump. First, I'll put the IV bag on the other side though. This pump operates from right to left, whereas the old Baxter's went from left to right. So we're going to thread the tubing from right to left and insert the green clip until we hear a click, pushing it all the way to the back of the pump. We'll also make sure that the tubings are in the notches at either end of the pump. We'll just make sure the tubing is in properly and close the door. The IV pump will then go through its settings of loading the tubing. This might be a good time to label your IV bag and your IV tubing. IV tubing gets changed every 4 days or 96 hours, and IV bags get changed every 24 hours. We can now open our roller clamp, and the pump has prompted us to do that. The pump is now asking us if we would like to prime the tubing, so we have confirmed that we want to prime the tubing. We are going to flip the ports upside down and try to get the air out of the ports. It gets trapped in there. So as it primes, we're going to flip over the ports and get the air out. The air is going to rise through the tubing and hopefully out the end of our tubing. You can see the air bubbles flowing through. The end of the tubing can drip over top of a garbage can. We'll inspect our tubing to make sure all the bubbles are out, and if needed, we can reprime. The pump will stop automatically when the priming volume is complete. You'll notice the end of the tubing has the anti-siphon valve, ASV valve, and we keep that on. We're going to confirm that priming is done, and that no, we don't need to prime anymore. If we happen to fill the drip chamber too much, we can flip the bag upside down and squeeze the solution back into the bag, just so that the drip chamber is half full. We want to be able to see the drips flowing. Perform a hand hygiene. And I'll put some gloves on. I'm now going to assess the normal saline lock. Because it's locked, I'm not sure if it is still patent, so I'm going to give it a flush with some normal saline and assess the site and ask the patient if they have any pain. I swab the port for 30 seconds and let it dry for 15 and attach a normal saline syringe. I would make sure that my normal saline syringe has no bubbles and will unclamp the light blue clamp. As I'm flushing, I'm going to assess the site and also ask the patient how it feels. I'm checking for any swelling, any pain, or any leakage around the site. We would want to flush with at least about 3 mL to properly assess the site. We can now program our pump. So for our volume, I would probably put in 450 mLs for the bag volume, just slightly less than the 500 mLs so it doesn't go dry. And then we would check our physician order to see how fast we should be running the infusion. We can now disconnect our syringe and attach our normal saline line. It would be wise to clean the port again and attach the tubing with the ASV valve. We're going to unclamp the blue clamp, and we're going to start our infusion and make sure that all of our clamps are open.